Hi, everybody. I'm Brittany Lewis, a breaking news reporter here at Forbes. Joining me now is Congresswoman Sara Jacobs. Congresswoman, thank you so much for joining me.
Of course. Thanks so much for having me.
I'm really excited for our conversation. Last week, you introduced the Childcare for Every Community Act on the House floor. Can you give us an overview of the legislation?
Absolutely. So I'm a 34-year-old woman. So basically, all I talk about with people my age is who's having babies, who wants to have babies, who doesn't want to have babies, and then how people can afford to take care of those children that they're having. And so we have known for a long time that childcare is in a crisis in this country, especially in high cost areas like San Diego, where I'm really proud to represent. Even before the pandemic, we didn't have enough childcare to meet people's needs. And we know that the pandemic only made it worse. So in San Diego County alone, we lost over 500 childcare providers that haven't come back. And nationwide, we are down over 60,000 childcare providers, that those jobs that haven't come back since the pandemic. And so we know that families are really struggling right now. And that's predominantly falling on the women who are largely being pushed out of the workforce because they can't find or afford childcare that meets their needs. And so what this bill would do is it would create a federally supported, locally run network of care so that no family pays more than 7% of their income on childcare. And if you make less than 75% of state median income, you don't pay anything at all. So for the majority of families in this country, over half of American families won't pay more than $10 for childcare. And this is incredibly important because we know actually that investing in childcare is some of the best investments we can make. We save $6 for every $1 we invest in quality early care and education. And it's also important because not only will this investment help families and help make sure children have high quality care, it will also help support providers who are largely women and women of color who are the people providing care and making sure that they have living wages and providing support so that we can build up the supply that we need. So this will create accessible, affordable, high quality early care and education for every family in this country.
I do want to break this down further, but I first want to talk about how did we get here? You mentioned that the pandemic really exacerbated this issue, but it was underlying. So when did the shift in childcare becoming unaffordable for a lot of Americans happen?
I think it's always an area that's been in need of more investment. We as a country decided that starting at 5 years old, we were going to invest in public education and decide that that was a public good. But actually, we know that so much of the early brain development and so much of what matters for a child's future trajectory is actually in those first 5 years. And yet we as a country largely have put that burden on families to figure out on their own. And frankly, largely it's fallen to women, whether it's mothers who are staying home or grandmothers who are helping to provide care, or the care workers that are largely women. And so even before the pandemic in San Diego, over 60% of families couldn't find childcare that met their needs. And as you said, it has only gotten worse.
And according to NBC News, the average age of a member of the 118th Congress is 57 and a half years old. From the top, you did say you're a millennial, you're 34 years old. So when it comes to this legislation, do you see your age as an advantage here?
Oh, absolutely. Look, it's no secret that Congress is a little older and a little whiter and a little maler than the country. And I do think that that has been reflected in what we have decided merits investments. For a long time, childcare was seen as a women's issue, something that was niche and only affected a particular segment of the population, when in fact, we know that childcare is something that is hugely important for the future of our economic growth. And I do think that the more that we're seeing women and young people coming into office, the more we're seeing this issue rise to the top. But look, I'll tell you, I've had colleagues on both sides of the aisle who I've been talking about this issue with, who will say things like, well, don't they just have an aunt down the street who can come and help raise the kids? Or I don't really understand, why can't they just find someone to help out? And I don't think it's a surprise, because for so many of my colleagues, they did have a woman likely in their life who did unpaid labor and took care of children. And that largely went unseen by them. And so I do think it's important that we start talking about the real cost of not having the support for families for this care infrastructure.
I do want to dive a little deeper into the male response here. You joined Senator Elizabeth Warren and Congresswoman Mikey Sherrill in introducing the act. What about male lawmakers specifically? What has been their response?
I will say I think this is less a gender issue largely in Congress than a generational one. So I will say that we have a lot of amazing male colleagues who have young kids themselves who completely understand the need for investments in childcare. Jimmy Gomez, congressman from LA, has talked a lot about how he and his wife have tried to make caregiving equitable in their family and how difficult that is, and how he gets thanked for taking care of his kids when she's just expected to do it, even though the care burden should really fall equally on both of them. And so I think there are a lot of younger male colleagues of mine who do have young kids who are pushing for this issue and understand how important it is. And I really do think this is a generational issue where we are seeing millennials who, by and large, graduated from college during the Great Recession, at the peak of our earning potential, had COVID, and just really haven't been able to have the supports that we need to be able to do things that earlier generations, I think, kind of took for granted, like buying houses and raising families.
Aside from being a generational issue, do you also see this being a bipartisan issue? You're a Democrat, and both Senator Elizabeth Warren and Congresswoman Sherrill are also Democrats. Have you gotten bipartisan support so far?
So at the moment, this bill is only being supported by Democrats in Congress. But I will say that the American people, including the majority of Republicans, want Congress to invest in quality early care and education and understand how important childcare is for the growth of our economy. And I think this is just another reflection of the fact that the Republicans in Congress are actually so far removed from their constituents who, by and large, want investments in childcare, by and large, support issues like reproductive health care. And I think we are seeing that divide continue to increase. And I'm hopeful that there are some of my Republican colleagues who will start to see that too. I know when I have private conversations, some of them really understand the need for this, especially the ones with young kids. And actually, I was a member of the Select Committee on Economic Disparity and Fairness and Growth. And one of the hearings we had, actually, the Republican witness was the one making the case for why we needed to invest in childcare. So this is a bipartisan issue, even if it doesn't look like that with my colleagues here in Congress.
I know you said you had private conversations with your Republican colleagues about this, but do you have any names, any specific lawmakers on the GOP side that you anticipate receiving support from on this legislation?
So on this legislation, we haven't started working on getting bipartisan support, but I will say I have been doing a lot of work with some of my colleagues on the other side of the aisle, especially Stephanie Bice from Oklahoma, around military housing and military childcare, and making sure that we're supporting our military families as they are needing that care. And I'm hopeful that we'll be able to continue doing that work and that we'll be able to broaden that to more of the population.
I do want to break down the legislation a little further, so I'm going to read you a description of what the act says. Half of families nationwide will pay no more than $10 a day for childcare, and all families would see their childcare costs capped. Can you walk us through how that would be possible?
Yes. So what this legislation would do is it would create a federally supported, locally run network of childcare centers. So it would have local sponsors, could be cities, could be nonprofits, who will run childcare networks supported by the federal government. And they will pay the childcare providers directly for the service. No family will pay more than 7% of their income. So it will be a sliding scale. So if you make less than 75% of your state median income, you won't pay anything at all. And then it will slide up from there so that no family pays more than 7% of their income, which means that for a majority of American families, they won't be paying more than $10 for this care.
That would sound incredible for, I'm sure, families with young children, but how much is this going to cost in total to implement this legislation?
Yeah, so we think it will cost around $700 billion over 10 years, which is about $70 billion a year. To put that in context, our defense budget just last year for 1 year was $800 billion. So this is the kind of investments the federal government regularly makes. But I think it's really important to note that while that sounds like a really big number, we actually know that the US economy loses over $290 billion a year due to not having care that is needed. And we know that every $1 the government invests in quality early care and education, we actually save $6 due to increased labor force participation, better outcomes for children, and higher wages throughout their life. And when other countries and municipalities have instituted universal childcare, they've actually seen that the investment has paid for itself because more people are coming into the workforce and because you're having those better outcomes for kids. So to me, I think that this is an investment we can't afford not to make for the future of our economy.
Sure, 700 billion. When you say it just without the context you provided, obviously that's a little bit of an eye-popping number. So where would that funding be coming from?
We don't have specific pay-fors in this bill. I personally think that we really need to reform our tax code so that the wealthy are paying their fair share. And we already have started on that path with the Inflation Reduction Act and are hopeful to do more. But I also think it's important to recognize that if you ask any business owner if they're going to take out a loan, take out debt to make an investment that they know will grow their business, 10 out of 10 times, the business owner will make that investment. And that's exactly what we're talking about. This is about making an investment that we know will grow our economy in the future. And so to me, it's less about exactly how we pay for it right now and more about thinking what kinds of investments are we making and what do we need to make to be able to grow our economy in the future. And this is one of those investments that to me is a no-brainer.
Do you think that you would be able to sell this to Republicans based on that price tag alone?
I think if you look at recent polling, the majority of Americans, including the majority of Republicans, believe that investing in childcare is incredibly important for future economic growth. And I think that families, regardless of their political persuasion, are struggling to find and afford childcare. And I'm hopeful that my colleagues will listen to their constituents and we'll see that this is an investment that we can't afford not to make.
I do want to talk about these child care centers now. Would they have to meet a certain standard in order to be operating?
Yeah, so this is all about all three legs of this. So one, it would make it more affordable for families. Two, it would ensure high quality care for kids. And three, it would make sure that providers are being paid a living wage and are getting the investments they need to be successful. And so there would be very stringent quality requirements. And we know that that high quality care is incredibly important, especially in those 0 to 5 years. But the other thing I think is important is part of this being a federally supported but locally run approach is that it wouldn't be a one size fits all approach. So it wouldn't necessarily be that everyone is going to a childcare center. This would also include family childcare providers, home care providers. It would allow the flexibility for families to find the care that meets their needs.
And how many would be in the community, or would that be based on community to community?
It would differ by community. It would be based on community need.
Great. And so population wouldn't play a factor in there? Or like how would you go for, would it be, oh, like let's say I'm doing California. Would you pick how many childcare centers are based on the population in California? Or are you talking to local community members?
Right. So there'd be a formula based on eligible families per state that would largely dictate the funding. But because it's locally run, but federally supported, it wouldn't necessarily be that we're saying it's going to be this many spots. So the way our current system works is that there are a certain number of subsidized spots that are available, and then we have a wait list. So there are many, many eligible families who actually aren't getting the spots because there aren't enough. What this would do is say there's this pot of federal money and these local sponsor organizations who are running these networks, they would be paying the childcare providers directly for the care that they're providing. And so it would be based on the kids in care versus a set number of spots. And it would be a sliding scale based on need.
And let's say your legislation does pass. What would be the timeline here? When do you think families could expect to get some relief in the child care field?
Yeah, if this legislation passes, we would try and get it implemented as quickly as possible. But it would likely be around a 5-year horizon in order to be able to make the investments we need to create the supply that we know is needed to be able to do this. And that's part of what this bill does. It's not only about the affordability piece, it also has investments for creating the supply we know we need to be able to provide all of that care.
Congresswoman, from the top of our conversation here, I can tell how passionate you are about child care in this country. Is passing this legislation one of your top priorities this term in Congress?
Addressing the childcare crisis is one of my top priorities this year in Congress, and frankly, one of the reasons I ran for Congress to begin with. I represent San Diego, which is an amazing place that has such a vibrant economy. And yet, even in San Diego, one of the wealthiest counties in one of the wealthiest states in the wealthiest country the world has ever known, before the pandemic, we had about 40% of our kids who were living in families experiencing poverty. And we know that those effects last long for those kids. And so I think investing in quality early care and education, making sure every kid is able to start out their life with access to opportunity and the support they need to be able to thrive is one of the most important things our country could be doing, both for the future of our economy and to build a more equitable society.
Obviously, you just brought this to the House floor earlier this month, but what's next for the legislation?
We're working now with my co-leads, Mikey Sherrill and Senator Elizabeth Warren, to build support and try and make sure that we are working hard to get as much support as possible so that we can hopefully get this passed.
Congresswoman Sara Jacobs, thank you so much for joining me.
Of course. Thanks for having me.